The government takeover of healthcare is making it harder for small businesses to hire new workers. My goal throughout the 112th Congress has been a full repeal of the law, followed by a step-by-step approach to healthcare reform that begins with lowering costs. The House voted twice to fully repeal the President's law, once in January of 2011 and the other after the Supreme Court ruling. Combined, the House has voted over 30 times to repeal, defund, and dismantle the law. That includes legislation to enact much-needed medical liability reforms to curb unnecessary junk lawsuits. There are too many frivolous lawsuits against good doctors. When doctors are forced to pay settlements, it drives up healthcare costs for all Michiganders and Americans. By reforming medical malpractice, we can keep good doctors practicing at lower healthcare costs for everyone. We also want to allow for the purchase of health insurance across state lines. Allowing a national market or regional markets to purchase health insurance could result in a much larger pool of individuals that reduce expenses and risk for insurers. This expansion will allow health insurance companies to offer insurance at lower costs to all those participating. Americans have the right to take control of their health care decisions. That's why we voted to expand health savings accounts, which will incentivize responsible planning for future health care expenses and encourages shopping for the best cost and quality in services. In March, we voted to strengthen the doctor-patient relationship by voting for legislation to repeal the Independent Payment Advisory Board, which is the President's unelected healthcare rationing board given power to restrict treatment options and deny access to care. I believe healthcare decisions should be made by patients, families, and their doctors, not by bureaucrats in Washington who are burdening seniors and future generations with less choice, fewer services, and more debt. Please know that I'll continue to work with my colleagues to develop and pass common sense solutions that reduce cost, increase access, and encourage job creation.